Hi, hello everyone. Welcome to Dr. Ravichandra Official. In this video, we will discuss a topic, something which is an extremely favorite topic for the examiners in the board exams. You need to remember this. And in the past 3 to 4 years, this question has been repeated a number of times. The topic is hyperbilirubinemias. Both conjugated and unconjugated hyperbilirubinemias are being dealt in this video. Unconjugated hyperbilirubinemia and conjugated hyperbilirubinemia. Unconjugated hyperbilirubinemia is because of the RBC destruction or increase in the RBC destruction, which will cause the release of the heme from the hemoglobin, and it is converted to unconjugated bilirubin. So the conditions that are causing the increased RBC destruction are the causes for unconjugated hyperbilirubinemia. All the hemolytic anemias, hemorrhages, ineffective erythropoiesis, conditions like pernicious anemia and thalassemia will come under unconjugated hyperbilirubinemia. Genetic defects, there are two syndromes that are associated with the genetic defects. One is Gilbert syndrome and the other is Crigler-Najjar syndrome. Gilbert syndrome is asymptomatic, precipitates only on stress in adults, asymptomatic in children. Whereas Crigler-Najjar syndrome, it is of two types, Crigler-Najjar syndrome 1 and Crigler-Najjar syndrome 2. So Gilbert syndrome and Crigler-Najjar syndrome will present with unconjugated hyperbilirubinemia. Coming to the conjugated hyperbilirubinemia. The clinical features that are seen in conjugated hyperbilirubinemia is there will be jaundice, there will be pruritus, dark colored urine, and clay colored stools. These are the characteristic features of conjugated hyperbilirubinemia. One is dark colored urine and the other is clay colored stools. Because of the malabsorption, there will be chronic diarrhea and release of the stools that are rich in fat, that is fatty stools called as steatorrhea. The causes for the conjugated hyperbilirubinemia is bile duct obstruction because of the stones or the infections with Opisthorchis sinensis or cancer in elderly patients. Or the cause may be biliary tract disease that involves primary sclerosing cholangitis or primary biliary cholangitis. Coming to the genetic defects or the syndromes that are associated with conjugated hyperbilirubinemia are Dubin-Johnson syndrome and Rotor syndrome. Dubin-Johnson syndrome is having a characteristic feature. There is dark pigmented liver. This is a picture of microscopy of liver showing the conjugated hyperbilirubinemia that is deposited in a case of Dubin-Johnson syndrome. Rotor syndrome also comes under conjugated hyperbilirubinemia, but it is a rare one. So, in the picture, you can appreciate the bilirubin that has been deposited in the hepatocytes. So, this is dark pigmented liver and it is stained using special stains for bilirubin. So, Dubin-Johnson syndrome. Among the conjugated hyperbilirubinemia, Dubin-Johnson syndrome and Rotor syndrome, they can be differentiated based on the pigment deposition. Pigment deposition occurs in Dubin-Johnson syndrome. So, there will be dark pigmented liver, D for dark, D for Dubin-Johnson syndrome. Whereas there will be no pigmentation in Rotor syndrome and there will be no hepatomegaly in Rotor syndrome. Whereas there will be hepatomegaly in Dubin-Johnson syndrome. This is the difference between Dubin-Johnson syndrome and Rotor syndrome. So, We will repeat once again: unconjugated hyperbilirubinemia and conjugated hyperbilirubinemia. The syndromes that are associated with unconjugated hyperbilirubinemia are Crigler-Najjar syndrome 1 and 2, Gilbert syndrome. Coming to conjugated hyperbilirubinemia, they are Dubin-Johnson syndrome and Rotor syndrome. Dark pigmented liver is seen in conjugated hyperbilirubinemia because of the Dubin-Johnson syndrome, and this dark colored granules are because of the epinephrine. This was the entire summary of the hyperbilirubinemias, both conjugated and unconjugated hyperbilirubinemias. Thank you for your patient listening and good luck for your examinations. Please like, share and subscribe. Dr. Ravichandra Official.